Good afternoon. I am Dr. Sanjay Das Gupta. I am attached to SSKM Hospital, GD Hospital, JN Roy Hospital. I am consultant nephrologist. Today my topic is pedal edema, its causes, symptoms and treatment. Now what is edema? Edema means accumulation of fluid in the tissues and body cavities. Now as a person is most of the time of the day upright, so the fluid accumulates in the legs. This is known as pedal edema. Pedal means legs. However, if a person is lying down for prolonged period, it is known as, he may have edema in the back, known as sacral edema. Sometimes the edema involves the whole of the body, including the body cavities like abdomen, pleura, around the lung, around the heart. It is known as generalized edema or anasarca. Now when investigating the causes of edema, we must think of varieties of causes including different organ systems. Suppose if a patient enters into my chamber with a pedal edema, that is swelling of the legs, first I should ask whether the patient is taking any antihypertensive or not, BP medicine like amlodipine, because amlodipine is known to cause edema. But this edema is harmless. However, it may cause problem in wearing shoes, walking, etc. And we may have to change the antihypertensive. Sometimes the patient has undiagnosed hypothyroidism. So we must check for free T4 and TSH level to diagnose the hypothyroidism and start thyroid hormone replacement therapy. And if it is inadequately treated hypothyroid, we must increase the dose of thyroid hormone therapy. Now coming to organ basis, if a patient comes with pedal edema and shortness of breath, that is respiratory problem, we must think of heart failure. Usually the heart failure patients complains of shortness of breath, that is dyspnea on mild to moderate exertion and sometimes even on rest. That dyspnea may be classified according to New York Heart Association class 1 to 4. Now on examination, a patient with heart failure may have prominent jugular venous pulse. On examination of the neck, we can find that the jugular veins are pulsating and dancing. And also on putting the stethoscope on the chest, we can find several sounds like crepitations or crackles. On investigation, ECG and echocardiography may give a hint towards heart failure, and there are certain blood tests like NT-proBNP that give a hint towards heart failure. Now coming to kidneys, a patient who is having kidney failure or renal failure may have pedal edema. However, kidney failure is not always necessary for pedal edema. Only proteinuria, that is passage of protein in urine but creatinine is normal, that is also sufficient to cause edema. So to diagnose renal causes, we must check a urea creatinine report and also urine routine to check for proteinuria. Sometimes liver disease, patients suffering from liver disease may suffer from edema, like chronic liver disease and cirrhosis of liver. These patients often have disproportionate ascites, like disproportionate swelling of the abdomen. Often they have jaundice and other hormonal manifestations and prominent veins over abdomen. Now to diagnose chronic liver disease and cirrhosis of liver, we must do a liver function test, hepatitis B, C tests. We must take history of alcoholism. We must do a USG abdomen to see coarse ecotexture of the liver. We should do an upper GI endoscopy to look for esophageal varices. We must do a Doppler splenoportal axis and also fibroscan of the liver to diagnose chronic liver disease. Chronic liver disease and cirrhosis may have pedal edema. However, there may be disproportionate swelling of abdomen in these cases. We have discussed about heart, kidney, liver. Now comes COPD, that is chronic obstructive pulmonary disease, that is lung disease. Often they are long-term smokers. They have involvement of the lung, and that lung cause sometimes secondarily involve the heart and may cause an entity called cor pulmonale, and that may cause congestive cardiac failure and pedal edema. Now apart from these organ systems and also drugs like amlodipine and hypothyroid, there are other causes of edema also. like obesity, obese patients, the patients who are overweight, they frequently have edema. Patients often have venous incompetence or venous insufficiency in the legs that may cause local tissue swelling and cause edema. Pregnant women. Previously it was thought that the pregnant women who are having pedal swelling or edema, that is a very bad sign. No, it is not that. Up to 80% of the normal pregnant women can have pedal edema. However, sometimes if it is associated with high blood pressure more than 140/90, that is known as preeclampsia. If it occurs after 20 weeks along with edema, that is bad. But normal pregnancy can also have pedal edema frequently. Sometimes a patient can have trauma in the ankle, like sprain, that may cause edema on a single leg. Sometimes a patient after trauma can have fracture of a leg, that can also cause an edema of a single leg. Sometimes, especially in diabetic patients, or even after minor or major trauma, a patient may have unilateral pedal swelling with redness of that lower limb. That is known as cellulitis, infection of that leg. That may also cause pedal edema. There are other causes of pedal edema like lymphedema. Suppose a patient residing in Orissa, he may have filariasis. That may cause lymphedema, lymphatic obstruction. Sometimes in certain cancers also, there may be obstruction of lymph nodes and cause lymphedema. It is common in breast CA and hands may be involved. Now, as there are lots of causes of edema, varieties of causes of edema, so there is no universal treatment for a single cause. You must seek what is the reason behind edema and treat accordingly. Like if the patient is on amlodipine, we may shift to other calcium channel blockers or other antihypertensives, thyroid hormone replacement. Heart failure has got several magical therapies like diuretics, mineralocorticoid receptor antagonist, ARNI, SGLT2 inhibitors, etc. Nowadays, heart failure is not that bad. There are 4 to 5 classes of drugs which we treat heart failure and they respond magically, and even with heart failure, patients live for 30 years. Kidney failure, again diuretics are the mainstay along with antihypertensives, and when there is advanced kidney failure, we must take out the fluid by dialysis, hemodialysis. And also the other causes like fracture we should treat, sprain of ankle we should treat, cellulitis we should treat with antibiotics, COPD we should give inhalers and nebulizers, chronic liver disease we should stop alcohol, and also treat hepatitis B and C. Hepatitis B and C have got good antiviral drugs nowadays. So individual organ systems must be treated. However, one thing I must tell, that whatever we treat, diuretics are the mainstay of therapy for edema. Apart from fluid restriction and elevation of limbs, etc., these are necessary. Diuretics are the drugs or medicines that excrete water and salt. They are the mainstay of treatment of edema in almost all causes like heart failure, liver disease, kidney failure, etc. Diuretics are of several varieties like thiazide or thiazide-like diuretics. Thiazide diuretic is hydrochlorothiazide, and thiazide-like diuretic is chlorthalidone and indapamide. Then there comes the most important and most potent, that is loop diuretics. Loop diuretics are used in heart failure, in kidney failure, and there are other drugs, other diuretics which are potassium retaining like spironolactone and eplerenone. They are potassium retaining, so we should, whenever diuretic we are used, we should check for sodium and potassium. Some diuretics lose sodium and potassium, some diuretics gain potassium. We should be aware of the electrolyte disturbances. Spironolactone and eplerenone are also used in resistant hypertension and heart failure. So, to summarize, there are a variety of causes of pedal edema. Pedal edema means swelling of legs. Some drugs may cause, we must stop those drugs. Sometimes hypothyroid, we should treat hypothyroidism. Local causes like infection and fracture, we should treat. And heart failure, renal failure, chronic liver disease, there are many drugs, especially in heart failure. But diuretics are the mainstay of therapy, and there are several classes of diuretics. Of them, loop diuretics like torsemide and furosemide are one of the most important drugs. And whenever we are using diuretics, we should remember that they should be used judiciously in various combinations so that there are no electrolyte disturbances. Thank you.